1. A nurse finds a coworker appearing drowsy, with slurred speech and the smell of alcohol during a medication pass. What is the nurse's appropriate action? Answer. Report the observation to the nursing supervisor immediately. Rationale. Nurses have a legal and ethical responsibility to report impaired coworkers to ensure patient safety and maintain professional standards. Reporting to a supervisor allows for appropriate intervention. 2. A terminally ill patient refuses further chemotherapy despite family insistence. What should the nurse do? Answer. Respect the patient's decision and advocate for their wishes. Rationale. Patients have the legal and ethical right to autonomy and informed refusal. The nurse must support and advocate for patient-centered care. 3. A nurse overhears two staff members discussing a patient's diagnosis in a hospital elevator. What is the nurse's best response? Answer. Remind them that discussing patient information in public areas violates patient confidentiality. Rationale. Nurses must protect patient confidentiality under HIPAA laws and the ANA Code of Ethics, preventing disclosure in public spaces. For a nurse is caring for a patient who states, "I want to donate my organs if I die." What is the nurse's priority action? Answer. Notify the charge nurse and document the patient's wishes accurately in the medical record. Rationale. Ethical and legal nursing practice includes honoring and documenting patient wishes regarding organ donation and notifying appropriate personnel. 5. A nurse witnesses a colleague administering the wrong medication to a patient. What should the nurse do first? Answer. Ensure patient safety by assessing a patient and then report the incident to the supervisor. Rationale. Patient safety is the top priority. After assessment, the incident must be reported following legal and ethical guidelines. 6. A patient signs an informed consent form, but later states they do not understand the procedure. What is the nurse's best response? Answer. Notify the healthcare provider to provide further clarification. Rationale. It is a provider's legal duty to ensure the patient fully understands the procedure before giving consent. The nurse acts as a patient advocate. 7. A nurse is assigned a task beyond their scope of practice. What should the nurse do? Answer. Decline the task and inform the supervisor. Rationale. Nurses must practice within their legal scope to prevent harm and protect their license. Accepting inappropriate tasks violates ethical and legal standards. 8. A nurse makes a medication error, but the patient suffers no harm. What is the appropriate action? Answer. Report the error according to facility policy and complete an incident report. Rationale. All errors must be reported regardless of patient harm to maintain transparency, promote safety, and meet legal obligations. 9. A newly admitted patient wants to leave the hospital against medical advice, AMA. What is the nurse's responsibility? Answer. Explain the risks, ensure the patient is competent, and have them sign an AMA form. Rationale. The patient has the legal right to leave AMA if competent. The nurse must ensure understanding and proper documentation. 10. A nurse delegates a bed bath to an unlicensed assistive personnel UAP. What should the nurse do next? Answer. Ensure follow-up and evaluate the patient's response after the task. Rationale. The nurse is legally responsible for supervision and evaluation of delegated tasks to ensure patient safety and quality care. 11. A nurse observes a healthcare provider speaking harshly to a confused patient. What is the nurse's ethical obligation? Answer. Report the behavior to the nursing supervisor. Rationale. Nurses must report abuse or unprofessional conduct to protect patients and uphold ethical standards of practice. 12. A patient confides in the nurse about a plan to harm themselves after discharge. What is the nurse's legal responsibility? Answer. Report the threat to the healthcare team immediately. Rationale. Patient safety overrides confidentiality when there is a risk of harm. Reporting ensures appropriate interventions and fulfills the duty to protect. 13. A nurse documents a false entry in the patient's medical record. What are the legal implications? Answer. Falsifying documentation is a legal violation and may lead to disciplinary action or loss of license. Rationale. Accurate documentation is a legal requirement. False documentation undermines trust, violates ethics, and may result in legal consequences. 14. A nurse refuses to participate in an abortion procedure due to personal beliefs. What is the appropriate action? Answer. Notify the employer in advance and request reassignment. Rationale. Nurses have the ethical right to conscientious objection, but must ensure patient care is not compromised by providing appropriate notice. 15. A nurse gives patient information to a family member without patient consent. What law is violated? Answer. This violates the Health Insurance Portability and Accountability Act, HIPAA. Rationale. HIPAA protects patient privacy. Disclosure without consent is illegal unless authorized or in specific exceptions. 16. A nurse suspects child abuse during a routine assessment. What is the nurse's legal obligation? Answer. Report the suspicion to Child Protective Services as mandated by law. Rationale. Nurses are mandated reporters of suspected abuse. Failure to report may result in legal penalties. 17. A patient wants to refuse a blood transfusion due to religious beliefs, but the family insists otherwise. What is the nurse's priority action? Answer. Honor the patient's right to refuse treatment. Rationale. Patients have autonomy and the legal right to refuse any treatment, including blood transfusions, based on informed decisions. 18. A nurse accidentally gives the wrong dosage of medication. What is the most ethical action? Answer. Notify the healthcare provider and the patient. Then document the incident appropriately. Rationale. Ethical nursing practice involves honesty, transparency, and accountability for errors to ensure patient safety and trust. 19. A patient requests to review their medical record. What is the nurse's appropriate response? Answer. Arrange for the patient to review their record according to facility policy. Rationale. Patients have a legal right to access their health information under HIPAA guidelines, and nurses should facilitate this process. 20. A nurse learns that a coworker is consistently leaving out required patient care documentation. What should the nurse do? Answer. Report the concern to the nursing supervisor for investigation. Rationale. Incomplete documentation can compromise patient care and is both a legal and ethical violation. Reporting ensures accountability and correction. 21. A nurse caring for an elderly patient suspects financial exploitation by the patient's caregiver. What is the nurse's appropriate action? Answer. Report the suspected financial abuse to Adult Protective Services. Rationale. Nurses are mandated reporters of all types of abuse, including financial exploitation of vulnerable adults, to protect patient welfare. 22. A nurse receives a subpoena to testify in court about a former patient's care. What should the nurse do? Answer. Comply with the subpoena and provide truthful, factual testimony. Rationale. Nurses are legally obligated to respond to a court subpoena and must provide honest, objective information without personal opinions. 23. A patient with dementia repeatedly tries to leave the facility. What is the nurse's legal priority action? Answer. Implement safety measures such as close supervision and notify the healthcare team. Rationale. Nurses have a duty to prevent harm and maintain patient safety, especially for cognitively impaired patients who may elope. 24. A nurse overhears a nursing assistant threatening a resident in a long-term care facility. What is the nurse's first action? Answer. Intervene immediately to stop the abuse and report the incident. Rationale. Nurses must act promptly to protect patients from harm and report abuse according to facility policy and legal requirements. 25. A nurse assigned to care for a patient undergoing a religious ritual is unfamiliar with the practice. What should the nurse do? Answer: respect the patient's beliefs and seek clarification or cultural consultation if needed. Rationale: culturally competent care is an ethical responsibility. Understanding and respecting patient beliefs promotes holistic care. 26. A nurse realizes they accidentally breached patient confidentiality by sharing identifying information in a staff room. What should the nurse do? Answer: report the breach to the supervisor and complete incident documentation. Rationale: reporting confidentiality breaches helps mitigate harm and meets ethical and legal standards for disclosure and correction. 27. A nurse is asked to witness a surgical consent, but the patient appears confused about the procedure. What should the nurse do? Answer: refuse to witness the consent and notify the healthcare provider for clarification. Rationale: nurses must ensure patients understand consent before witnessing it. Otherwise, it is legally invalid. 28. A nurse notices that a colleague frequently delegates tasks to unlicensed staff that require nursing judgment. What is the nurse's responsibility? Answer: report the unsafe delegation practice to the supervisor. Rationale: nurses must ensure delegation is safe, appropriate, and within the scope of practice to protect patients from harm. 29. A nurse finds falsified vital signs in a patient's chart documented by another nurse. What is the correct action? Answer: report the falsification to the nursing supervisor immediately. Rationale: falsifying patient records is a serious legal and ethical violation requiring prompt reporting for investigation. 30. A terminally ill patient requests palliative sedation to relieve unrelenting suffering. What is the nurse's ethical role? Answer: advocate for patient comfort and collaborate with the healthcare team to honor the request. Rationale: nurses must advocate for quality end-of-life care, respecting patient autonomy and comfort-focused interventions. 31. A nurse witnesses a coworker consistently ignoring a patient's call light requests. What is the nurse's ethical responsibility? Answer: report the neglect to the charge nurse or supervisor. Rationale: neglect violates patient rights and ethical nursing standards. Reporting ensures appropriate action is taken. 32. A nurse accidentally administers a medication by the wrong route. The patient is stable. What is the next best action? Answer: notify the healthcare provider and complete an incident report. Rationale: medication errors must be reported promptly to ensure appropriate monitoring and to meet legal documentation requirements. 33. A patient tells a nurse, "Do not tell my family about my new diagnosis." What is the nurse's best response? Answer: respect the patient's request and maintain confidentiality. Rationale: patients have the legal right to control their health information unless disclosure is legally mandated. 34. A nurse observes a patient's advanced directive declining CPR, but another nurse begins chest compressions. What should the observing nurse do? Answer: remind the team of the patient's DNR status and stop resuscitation efforts. Rationale: nurses must advocate for patient rights and honor legally binding advance directives, including DNR orders. 35. A nurse is asked to float to a critical care unit without recent training. What is the nurse's ethical obligation? Answer: inform the supervisor of lack of competency and request appropriate assignments. Rationale: nurses must practice within their competency to prevent harm and maintain safe patient care standards. 36. A family insists on viewing a deceased patient immediately, but the patient is in a shared room. What should the nurse do? Answer: provide privacy By moving the patient or family to an appropriate location. Rationale. Ethical nursing practice respects family needs while maintaining the privacy and dignity of all patients. 37. A patient requests that the nurse not disclose their HIV status to their sexual partner. What is the nurse's legal obligation? Answer. Follow state reporting laws while maintaining patient confidentiality as much as legally possible. Rationale. HIV disclosure laws vary by state. Nurses must balance confidentiality with public health requirements. 38. A nurse receives a social media friend request from a current patient. What is the appropriate response? Answer. Decline the request to maintain professional boundaries. Rationale. Ethical nursing practice requires maintaining professional relationships and avoiding dual relationships that can compromise care. 39. A nurse finds incomplete documentation in a patient's chart during end-of-shift review. What is the best action? Answer. Notify the previous nurse and ensure documentation is completed appropriately. Rationale. Accurate, timely documentation is a legal requirement to ensure continuity and quality of patient care. 40. A patient with terminal cancer asks the nurse if assisted suicide is an option in their state. What is the nurse's ethical action? Answer. Provide factual, non-judgmental information based on the state's laws and refer to appropriate resources. Rationale. Nurses must provide accurate, unbiased information within legal limits while supporting the patient's right to be informed. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.